America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Our producer, Mr. Darren Wilhite, the man behind the camera, Dave Thiessen. We are here today on America's Healthcare Advocate. We thank you for joining us and making us one of the most listened to talk shows throughout the United States. You can follow me on Facebook and Twitter at America's Healthcare Advocate. Also, I want to remind you, I do this every show, and you probably wonder why I do it. I do it because I keep getting asked, where are you on? Okay, so the podcast platforms that we are on, Spotify, Stitcher, Spreaker, SoundCloud, TuneIn, Amazon, RSS, Pandora, Google Podcasts, Odyssey, YouTube, Apple, Pocket Casts, Overcast, and Rumble. And in addition to that, we are also on YouTube. And I want to thank all of you out there. Our numbers keep going and growing dramatically. We had 225,000 downloads and views on YouTube since the beginning of this year, 48,000 downloads on our podcast platform. It is remarkable, and we want to thank all of you. We also want to thank all of you that are listening on the AM and FM stations around the country. We greatly appreciate you. If you have questions or comments, americashealthcareadvocate.com is the website. Send me an email. I'm happy to get back to you. Also, if you are chronologically challenged, one of those seasoned citizens like me, and you are looking for Medicare coverage, you want to reach out to the lovely ladies, Carol Lee Steele or Joyce Thompson at RPS Benefits by Design. Anywhere in the country, they can help you. 877-385-2224. Also, if you are looking for group or medical insurance for an employer, they can also help with that. Maria Allers is the one you want to contact there. That phone number is 877-385-2224. And the website, RPS Benefits by Design, Inc.com. All right, we've got a unique show today. Joining me in studio is Dr. Stephanie Akime. She is the Regional Medical Director for CenterWell. And here's why this is different. I had a great lunch meeting with Drew Hare, who is the president of CenterWell here in the Midwest. And I was amazed by the way they do what they do, which is provide primary care for senior citizens. It is a unique practice and very unique in the way they deliver health care, and their results are significantly different. So welcome to the broadcast, Doctor.
Thank you so much. Thanks for having me.
Well, and you know, I really appreciate Doctor being here. She, in addition to being the regional director, she still sees patients, if you can believe that. So a little bit about Doctor. Doctor is the CenterWell Regional Medical Director, supervises healthcare services and monitors patient experience with healthcare outcomes to ensure each one meets their quality of healthcare standards. The RMD builds strong relationships with specialists and providers focused on serving seniors to establish a referral network for patients. In addition to the RMD, oversees CenterWell's wellness program. Stephanie Akime is a doctor of osteopathy, originally from Long Island, New York, but attended St. Joseph's University in Philadelphia, where she received her undergraduate degree in biology. She then earned her medical degree from the University of Medicine and Dentistry of New Jersey, now known as Rowan University School of Osteopathic Medicine. Dr. Akime completed her residency and training at St. Joseph's Hospital in Philadelphia, PA. Once again, welcome.
Thank you so much.
You know, when I had lunch with Drew and I started listening to what you all do, and I've seen CenterWell around town, but I really wasn't aware of all of how your program worked and how you're delivering primary care. I guess the first thing that is remarkable to me is it's only for seniors.
Only for seniors.
Okay.
Yes.
So that's a little different when you walk into the waiting room at a CenterWell clinic versus when you walk into a primary care clinic and there are 35, 36, 40 people sitting in the waiting room of all ages and types. You're doing nothing but talking to seniors. Talk about why that is.
Well, you know, being a senior is a special part of your life, and it requires more attention. And we feel like you can't get that in a regular doctor's office. Visits are 15 minutes, and you get about, like you said before, about 7.5 minutes to see the doctor. When you are a senior and you have all these chronic conditions that needs more attention and special detail, you need to have more time with your provider. And so that's what we want to focus on. We want to be good and focused on taking care of our seniors with the specialty that their needs to have that attention. And so we can only do that if we have doctors who have the resources, who are trained specifically to help care for our seniors and their needs.
So let's go back to that for a minute. You said 15 minutes, and the average time, as you mentioned, with the doctor, this is 7.5 minutes is what you get. Think about that now. Now contrast that with, you know, when I sat down with Drew, he said you're spending 45 minutes to an hour with the patient when they come in and sit down. That's hugely different.
Yes, because we want to treat the whole person. Health is not only just the disease and the medication. There's lots of factors. We need to know, how they're living, who's taking care of them, what resources do they have, are there barriers to how they can take care of their health. That takes time. That takes getting to know the patient. And you can't do that in 7.5 minutes. You can't do that when you have a panel of thousands of patients. Our job is to get to know the patient in every aspect of their lives to make sure that we give them the most success to have better outcomes for their health.
That's just radically different than the fee-for-service model because, you said it. What happens to the average physician in a primary care model that's a hospital or a large primary care practice is, what are they saying? They've got a patient load of 1,000 patients or more typically.
More, at least they have a patient load at least of 1,000, 1,500 to 2,000 is what you typically see. And ours, we find that around 500, maybe 600 patients per provider is what we find to be the most effective in taking care of our patients.
That's like 1/4 of what the fee-for-service model is. So obviously, it's funny. Drew told me that he has a waiting list of doctors that want to come to work at Centerwell, and I think I just figured out why.
Right.
I mean, you get to do what you do.
Right.
You get to actually sit down and treat the patient, not buzz in and go, here, we're checking this. Oh, here's a new prescription. Boom, boom, boom. And we're done and they're out the door again. This is a totally different way to do this.
When doctors go to med school, we are trained to take care of the whole patient. And we can't do that if we're seeing them for 8 minutes. So this is an actual model that actually prepares the doctor to train how they were trained to take care of patients. So where else are you going to find where you can take care of the patients, you get 40-minute to an hour visits for the patients, and to find out what other barriers they have that affect their health?
That's interesting because you say that. I think it's important to understand that what you're doing is you're actually sitting down and talking to the seasoned citizen, as I lovingly refer to myself and those of us, I'm 74, to understand what are the underlying things they're dealing with.
Right.
If you're only in there and out of there, in the very quick 7.5, 15 minutes, whatever it is, okay, you're not going to have time to go, well, tell me about what else is going on in your life. What else are you dealing with? Are you dealing with anxiety? Are you dealing with depression? Are you dealing with mental health issues? Okay. Yep. I just had a friend of mine who lost his wife after being married 38 years. He is going through a very difficult time right now. And I'm like, Mike, you need to get into some kind of grief counseling. It's because I remember when this was gone, he goes, Carrie, I don't know what I'm going to do. She's my whole world.
Right.
Well, I've been married 38 years, and if I lost my wife, I don't know what I would do.
Right.
So, but things like that happen.
Right.
Okay, in your practice, that's something that person coming in to sit down could talk about, and then you would do what? Get them into?
Well, so we provide services that we know affect seniors. So in our organization, we actually have behavioral health, a nurse practitioner.
Okay.
And so she serves as just our patients. So, with COVID, life happens, things change in our lives. And so sometimes we have a hard time coping with that. And so we need to provide those services for our patients that, it's difficult to get into a psych doctor now.
Oh,
it will take months.
It's extremely difficult to get in.
And so some things cannot wait. We need to make sure that we're treating this as soon as we can. So now we provide that behavioral health service for our patients so that they don't have to wait, and then they can get the care that they need while they're taking care of their other problems and your other healthcare conditions.
This is, as I said, when we started this, you're going to find this to be very, very different. And you're going to find this model to the way they do healthcare for seniors is just something I've not seen before. There are other clinic models out there, but there's not one that is completely focused on seniors that does what they do, like this behavioral health issue. I mean, imagine you're not going to get the referral here. You need to go see a psychologist or psychiatrist to talk about your problem, your grief, or whatever the case may be. COVID, a child, whatever it is. We've got somebody right here, and that. To me, first of all, what happens when you tell somebody that versus sending them out to a referral,
right.
They're going to make the connection. When you do the referral, those numbers drop like a rock, and that's one of the differences with this program. So we're going to continue this conversation with Dr. Stephanie Ekime when we come back from the break. If you want to learn more about what they do, go to the website centerwellseniorcare.com. Centerwell Senior excuse me, you think I did radio? Centerwell Senior Care.com. Go to the website or call 913-914-8202, and they'll be happy to chat with you. Stay tuned. We've got more right here on America's Healthcare Advocate.
The Golden Rule. Treat others as you want to be treated. I'm Steve Keeker, and this is one of the founding principles of my firm, Senior Care Consulting. Since 2002, our value statement has included honor our mother and father, respect our elders, care for those in need, and treat your family as our own. We've been honored to help hundreds of families make one of the most difficult decisions they could ever make, serving them in their greatest time of need. If you're looking for someone who can provide you experienced and objective guidance when searching for a senior care community, reach out today and discover the services of Senior Care Consulting at 913-945-2800, 913-945-2800. Know your options and choose with care at seniorcareconsulting.com.
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. In studio with me today, Dr. Stephanie Akime. She is the Regional Director for Centerwell Senior Primary Care. You know, this is a very different way of getting primary care. And if you're a senior citizen out there, and how do I access this? Well, if you're on United, if you're on Aetna, if you're on Cigna, if you're on Humana, you have access to these clinics. There are 7 of them throughout the Kansas City Metro. Is that right? I got it right. I didn't screw that up. Okay, so if you want to just learn what they do and how, if you're looking for a different kind of primary care, maybe you're sick of that 7.5 minutes. You'd like to really be able to sit down with the doctor and talk about some issues. Maybe it's a sleep issue. Maybe it's neuropathy. I mean, who knows, right? This is an opportunity to do that, and it's all in one place, and it's very, very convenient. Their website, CenterwellPrimaryCare.com, CenterwellPrimaryCare.com. That is the website. If you just want to call them and chat with them, 913-914-8202. So, Doctor, let's talk a little bit about, what I think really stands out here is you have a dedicated care team. So typically, in a typical primary care model, you see that doctor. If you need to see a neurologist, if you need to see an ortho doctor, if you need to see, whatever the case may be, you're going to get referred out. You have to go someplace else. And then you get to make the appointments. That's always a lot of fun, okay, as you sit on hold and go through 14 voice prompts. And so talk about how this is different the way you do it and the fact that you've got a care team. Who is on that team?
Right. So, of course, the doctor's always, I call the quarterback, right? Because they run the team. They make sure that they provide the services for their patients. So one of the best persons that we have to help with our patients is the referral coordinator. If you need an x-ray, mammogram, DEXA scan, they're there to help you make those appointments and get that started. They also make sure that it's covered by your insurance. Nothing's worse than actually going someplace and finding out it's not even covered.
Yeah, and that happens, especially on labs,
right?
And that kind of thing. You show up at a particular lab facility, and you have the lab done. Then you get the bill in the mail saying, "Oh, that wasn't covered."
Right.
Oh, because they're out of network.
Right.
Well, how were you supposed to know that? Right?
Exactly.
So you're doing all this for your patients as they come in. Life just got a lot easier, right? Okay.
If we want our patients to be compliant of what we want them to do, we have to make it easier for them to do it. Why put those obstacles in front of them?
Yeah, and here's the other thing. So I mentioned this in the last segment as we were going out. So you're told to go see this doctor, go see that doctor, go see another doctor. Well, how many of those patients on a percentage basis don't really follow through with that? Or they try the first time, they get the doctor's office, they leave a voicemail for the nurse, typically, or whoever, okay, the scheduler, and then maybe they get a call back, and if they miss the call or don't recognize the call, now they're trying to cycle through it again, and you're going through this whole rigmarole.
Exactly.
What you're doing is we're going to take care of that.
Right. Exactly.
That's a different way of doing this.
It is, and it ensures that what needs to be done is done. And not only that, we just don't leave the patient to the specialist. Let's say it's an orthopedic, and we don't know what happened. How am I supposed to take care of you if I'm not knowing what happened at these visits? They have to close the loop. And that means getting the consults from those doctors so we know exactly what's going on with the patient when they see their specialist as well.
And so okay, and I've gone through this with my wife, who I've talked about her issues before, where she goes to see a doctor and then she has to go up and pull the medical records from the doctor and get them over to the next doctor. You're saying that your care coordinators, your referral coordinators, care coordinators, they handle all this.
Right, and we want to send our patients where they're feeling they're taken care of and they have great specialists that knows what they're doing and also taking care of the patients how we want to take care of the patients. So how are we supposed to send you to someone who never gives us anything or we don't know what's going on? That's not good care. And so we want to make sure that not only are we giving you to people that we trust and that we have a good relationship with, that we know that they're taking care of you how you should be taken care of.
So you're closing the loop. You're dotting all the I's, crossing all the T's. Now, so as that relates, because I've seen some of the numbers to effectiveness, that's got to improve that patient experience and those outcome-based ratios of, hey, we got that neuropathy problem handled, or, oh, we got that neurological problem handled, or whatever, or the sleep study done, or that has to change that outcome, yes?
It does. And of course, I mean, let's say you're seeing the cardiologist. He made changes to your meds. I need to know those changes because that is critical to the care that you're giving. What if I gave you something that interacts with the medication that they gave you? Or I'm giving you something that's not effective and we're wasting time on trying to treat this particular disease.
You know, that brings to mind an interesting situation I had where Lori was prescribed a medication. And when I went to the pharmacy and picked it up, the pharmacist came to the window and said, look, I want you to understand something. We don't think she should be taking this med. And he gave me the sheet of the effects of the med with something, the other thing she was already taking. And I was like, well, she can't take this. Mm-hmm. And we went back to the doctor, the specialist who had written that prescription, and said, good thing the pharmacist checked this because this would have been a real problem.
Absolutely.
If she had taken it. She would have had a very difficult medical situation. So what you're doing here is you're avoiding all of that by keeping everything in one place.
Right. And so it's critical in order for us to have the best care for our patients and making sure we have best outcomes that we need to know exactly what's going on, no matter who sees the patient, whether it be the specialist, whether it be us, whether it be a pharmacist, we all have to be involved. It's a team effort to make sure we're taking care of the patient correctly.
Yeah, I guess the other thing that's interesting is because this happens as well, is, is this going to be covered by Medicare or is it not going to be covered by Medicare? Are you going to get a secondary bill for this? This has happened to me, okay, where you have something done and then you find out, oh, that wasn't covered by Medicare, but it was ordered and you had it done. Now you get to pay for it. So you're taking care of all that up front.
Right, exactly. If I'm ordering something, there's no point of ordering if you can't afford to get it, right? And so this is why we have a resource coordinator as well, to making sure that if there's services that the patient needs, we want to make sure that you guys it's affordable for you and you guys can get that. So let's say you have a CT scan. All those require prior auths.
Right.
And so I don't know if you have a copay. I don't know what's covered, what's not covered. Let's get that done prior to you getting that so that you're not wasting your time going there and you can't even afford to get that. And so that is why it's important that we have this team. We have the referral coordinators making sure that they do that job first before you get that stuff done.
And you know why that's important? Because every one of these Medicare Advantage plans, which is typically what the kind of folks that they are servicing at these clinics, every one of these plans has different copays and different out-of-pockets. So you may have a $350 copay to do a CT scan, or you may have a $10 copay. It depends on the plan.
Right. Exactly.
Yeah, and no two are the same.
No,
everybody's got a different way of doing it. And especially if you have changed, let's say you went from a Blue Cross plan to Humana or Humana to United, well, the benefits all changed. If you're trying to go through and figure that stuff out, that's a lot of time and effort, and maybe you'll get it right and maybe you won't. But here, they don't have to do that.
No, that we take that off of you. So we make sure that that's not something you should be worrying about. That's something that we should be doing, and so that you can focus on taking care of yourself.
This is really a different way of delivering care to seniors. And one of the things I wanted to do today, we'll come back from the break in the next segment, we'll talk a little bit about this. If you are part of the sandwich generation, you've got a mother, father, grandmother, grandfather out there, and you're responsible for their care, and you're shuffling them off to the primary care, and you're shuffling them off for this or that or whatever the case may be. Maybe it's a spouse, whatever the case may be. This is a different way of doing that will probably simplify your life. And I would strongly suggest that you take a look at what CenterWell is doing. If you've got, one of those folks on a Medicare Advantage plan, Medicare Supplement plan, they can certainly help you. The website is CenterWellPrimaryCare.com, CenterWellPrimaryCare.com. The phone number, 913-914-8202, 913-942-8202. If you just want to call and talk to them and find out what they're about, call them. They'll be happy to chat with you. Stay tuned. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. The doctor's in the house. Stay tuned. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the fruited plain here on the HIE Radio Network. My producer, Mr. Darren Wilhite, the man behind the camera, Dave Thiessen. We are coming to you today from the Odyssey Studios. Joining me in studio, Dr. Stephanie Akime. She is the Regional Director, Medical Director for CenterWell Senior Primary Care. This is just a very different way to if you're a seasoned citizen out there, like me, and you're looking for primary care, or maybe you're not happy with where it's going. Maybe you're tired of sitting in a waiting room with 35 or 40 people and getting that 7.5 minutes. This is a different way to receive care. I mentioned this on the way out a minute ago. If you are one of the sandwich generation, it's your mom who's 90 years old, okay, or your dad who's 85, whatever the case may be, and they need help. I talked to somebody the other day in Illinois, 77 years old, in a wheelchair. He's a vet. Agent Orange has crippled him. He's in a wheelchair, and his wife is responsible for everything. He's got all these different doctors he has to see. What difference would it make if they could go to someplace like CenterWell? The CenterWell clinics are very, very different in what they do. There are 7 of them in and around Kansas City. If you want to learn more about it, CenterWellPrimaryCare.com, CenterWellPrimaryCare.com. If you just want to call them and have a chat, 913-914-8202, 913-914-8202. So let's just do this. An intake. So walk me through how this works. I show up there. This is my first time. I got the appointment online, or I called and got an appointment. What's going to happen now?
So let me tell you, the first thing we do is all of our staff meets in the morning. We have huddles. So you'll go through my schedule, and we'll talk about every patient I'm going to see, down to why they're coming in, if there's any referrals that need to be done, if there's any labs I have to follow up with, any preventative screens that have to happen, if we need to refill any medications for the patients. We go through a thorough investigation of all our patients on that schedule. So by the time you come in, we know exactly what we have to do with you.
Well, right out of the gate, people, that's a lot different than what you typically experience.
There's a lot of things that goes behind the scenes. We don't want to drop the ball on any aspect of your healthcare. And so we have the referral coordinator. We have the medical records people that participate in the huddle. We have our integrated pharmacists who work with our higher risk patients.
Okay, stop right there. You have an integrated pharmacist?
We have an integrated pharmacist who work with our high risk patients, our patients who are going to the hospital a lot, or who have uncontrolled diabetes or uncontrolled congestive heart failure. These are our most vulnerable patients. We have to make sure that we're providing as much as we can medication-wise, making sure that they have the conditions under control. That's a very important aspect of their health. So we want to make sure that we're doing everything we can, especially with our most vulnerable patients, that we're taking care of them correctly.
So now you've had the huddle. Here I am. I show up now.
So you show up. So when you first come in, you're going to see the waiting room's not busy. It's not full. We definitely make sure that we want to keep our waiting room safe. More people, more chronic conditions, more you can catch things.
Yeah, that's exactly right.
And so we want to make sure that doesn't happen with our patient. You guys are already vulnerable as it is, catching those things. So no, we keep our waiting rooms as less patients or less people as possible so that we can keep you guys healthy the minute you guys come in. The front desk already knows what's happening. They participate in the front huddles. They know who you are, your insurance, making sure you sign all the correct forms so we can get all the information as possible because you're a new patient. We want to make sure we gather everything that we can from every specialist, your previous primary care doctor. Once you come in, you don't sit too long. Our nurses coming in or our medical assistants coming to get you, bring you back into the room as fast as we can. put you in the room. They're asking all the critical questions. What medications are you taking? Did you bring them with you? What chronic conditions do you know you do have? Are you living by yourself? Do you have a caregiver with you?
Interesting. So you're here we go with the caregiver again. So now the daughter or the son, like my daughter goes to the doctor with my wife every time we go.
Right.
Okay. They get to come in.
They get to come in.
Okay.
We have seats ready for them if they have a caregiver.
Okay.
We prefer if they're there. The more people involved in the person's health care, the better.
Okay.
Right? Because sometimes you need 2 or 3 perspectives on how to take care of the patient.
Yep.
They'll ask, your surgical history, your past medical history. They'll ask if there's any specialists that you're seeing. Who are they? When's the last time you saw them? We want to gather as much information as possible because we know that if I know as much as I can about you, then we can provide the best health care for you.
Okay, so they got all that up front. Now you walk in the room.
So I walk in the room. We get to know each other. Hi, I'm Dr. Ikemi. I tell you a little about myself. Then I ask you any questions about, your health, any concerns that you have, any barriers that you have, who's taking care of you. Is there anything you want me to know? Is there any refills on your medications you have? Any recent labs? Anything that's ongoing that I should know about? Anything new that's popping up? We get into a thorough investigation of what's going on with our patients so that we know exactly what the next steps are on how to treat the patient.
Now, do they get to? So now they've got this team. They've got you. They've got the caregiver. They've got all these people.
Yep.
Do you get to stay with that same team, or you get shuffled around?
No. All our centers have one team. So you know who your referral coordinator is. You'll know who your medical records person is. You'll get to know. We even have care coaches. Let's say you got sick and you went into the hospital. My care coach will call you or your caregiver and say, "Oh, we found you in your hospital." I have my care coaches. I've seen them call my patients in their beds. They will call them while they're in the hospital. Talk to talk to the doctor there. Talk to the nurses there. I mean, that's how involved and invested we are to make sure you're okay.
That is really different, people.
Yeah.
I mean, that is really,
we will
really
call
different.
You in the hospital, if we can get access to you, we absolutely will. Because we need to know what's going on, what's happening in the hospital too. Your care doesn't stop when you leave the doors. Your care continues when you leave. We have to know what's going on. We even when you leave the hospital and you're discharged, guess who's calling you? Our care coach, making sure that, okay, we need to have a follow-up. What medication changes did they do? You need to know exactly what happened so you're aware, I'm aware, and we know how to move forward.
Okay, so we've got about 4 minutes left in this segment. Now, and let's just focus on one issue here. You mentioned this earlier. There is an epidemic of diabetes in this country,
Yes.
of pre-diabetics, type 2 diabetics, and type 1 diabetics. So let's just say I'm a type 1 diabetic or type 2. That management of that care is critical. Getting those A1Cs X number of times a year that you're supposed to do, checking to make sure your insulin levels are right, prescribing, etc. Talk about how that because I know there's this program for it. I saw it when I was going through your material. There's a specific program for managing diabetes.
Yep.
And how does all that work?
Well, first it starts with me, right? Your diabetes is not under control. I got to make sure I'm putting you on the right meds and how to take those meds to make sure that we get it under control. But this is very confusing. There's pills, there's injections, you're checking, there's glucometers. Now there's, continuous glucometers. So we're all trying to figure out how to best manage this. So once you leave those doors, you have your care coach who also does chronic management program. So she's calling you 2 to 3 times a week. Hey, Carrie, what's going on?
Seriously?
How's your sugars?
2
Did
to
you
3
check?
times a week?
Yeah, making sure, and if we need to contact you more just to have any questions, we're here for you. We want to make sure you have a good control of your diabetes because we know if it's not controlled, it leads to other things.
Oh.
It leads to kidney failure,
Comorbidity.
the comorbidities in the hospital. I mean, people die from complications from diabetes all the time. And so if we want to make sure that you definitely understand how the disease process works and how to take control of taking care of those diabetes.
Okay, so they miss the A1C.
Yeah.
And they don't get it done. Is your care coordinator calling and saying, hey, you got to get that A1C done. You're
Yes, she
2
has.
weeks off.
She has access to my schedule, and she'll call me, Dr. Ikemi. Carrie's sugars are out of control. We need her in the office. Let's check the diabetes. Let's check the blood sugar log on the glucometer. Let's see what's going on. Perfect. You come in, I talk to you, I say, look, let's tweak this. Let's start you on this. Talk to the care coach. I started him on this. We're checking 4 times a day. Make sure you call him, see how his sugars
4
are.
times a day.
Yeah, you check your sugars. We have to do whatever we can to get that blood sugar under control. We
That
have
is
to.
intense.
It's intense. But once we get under control, then we can talk about, okay, maybe 3 times a day or 2 times a day. But the key is to get it under control, because we know the detrimental effects of what happens when you don't have it under control.
That is radically different, people, than diabetes management in a typical primary care practice, and the way that it's done. And here's the other thing. I'm going to go back to this again. If you're the caregiver and you're hearing all this, hey, your dad missed his A1C, or hey, your dad's blood sugar levels are all over the place, and we need to get him in here and take a look at his insulin and see what we're doing. Maybe we need to get him on an insulin pump, or maybe we need to get him on insulin pen, or something. So data is being shared back and forth
between the provider and the nurse, who's trained in diabetes. They're trained to do diabetes. That's what they do. So they are there to help to make sure you're eating right, you're checking your sugars, you're taking your medications correctly. So
they're specifically trained in diabetes management.
Yeah, they're specifically trained to do diabetes management.
That's remarkable. This is a very, very different way to deliver primary care. And I hope you're seeing why I wanted to do this show today, because, we try to do things here that inform and educate and give you a better way to take care of your health. It's called America's Healthcare Advocate for a reason. We're advocating for you to do what's in your best interest for health. I think you're going to find this is going to be quite a remarkable program if you take the time to look into it. The website is CenterwellPrimaryCare.com, CenterwellPrimaryCare.com. Go up online, make an appointment, go in and see Dr. Kime or one of her associates and find out what this is all about. And again, if you're a caregiver, you really ought to take a look at this. Phone number 913-914-8202, 913-914-8202. Give them a call if you just want to chat. We'll be right back after the break. You're listening to America's Healthcare Advocate, coast to coast across the USA. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. In studio with me today, Dr. Stephanie Akime. She is from CenterWell Primary Care, and we are talking to her about primary care for those of us that are chronologically challenged. If you're in the Kansas City Metro, they have 7 clinics. I'm going to name them. They have one on Olathe, one on State Avenue in Kansas City, Kansas, one in Grandview, one in Independence, Missouri, one in Midtown over on 301 Armour, one in Raytown, and one over in the Truman Medical Center in Independence, Missouri, or over by Truman, Independence, Missouri. So there's 7 of these with access in Kansas and Missouri. No reason you can't find one, and no reason you can't go to one. Again, if you're looking for a different way to receive primary care, maybe you're not happy with what you've got, or maybe you're one of those people who doesn't have a primary care doctor, you might want to take a serious look at CenterWell. The website is CenterwellSeniorPrimaryCare.com, and the phone number 913-914-8202, 913-914-8202, if you want to give them a call and chat. Let's talk about some of the other things that you do. So this is unusual. Same day appointments. Is that for real?
That is for real. Now, we know access to healthcare is a barrier for people, and we want to make sure we provide that access and make it easier for our patients. So, number one, we provide transportation to our office.
Whoa. Back up. Okay. You do what?
We provide transportation for our patients to our office. We don't want any barriers to why we can't see our patients. So if you need a ride, we'll provide that for you.
You're hearing this? They will pick you up and bring you. And I'm back again to the caregiver. You're the caregiver. You don't have to go get mom or dad and take them, or grandma. They'll bring them, and you can join in person, or you could probably join virtually.
We can join virtually too. Absolutely. And we know things happen. We know there's emergencies, acute things that happen. So all provider schedule, we leave same day appointments. We have to protect that time to just in case someone needs to be seen. It could be upper respiratory infection, a urinary tract infection, those things that could be easily treated in the office and not go to the emergency room where they're waiting and around sick people. Why they can't come into the office and we can treat that? We have to provide the time for our patients for those things.
I've had serious problems this year with upper respiratory issues. I had COVID, RSV, some of these other things that happened. And I went to the ER.
Yeah.
That's exactly what I did, because getting in to see the doctor was like not going to happen anytime soon. So this is a completely I could have gotten a same day appointment and been in. And
in and out, you avoided wait long times in the ER, and you're not around all these sick people. and you got treated when you needed to get treated.
I got up on a Sunday morning at 6 o'clock and went to Advent Emergency Room because I knew I could get in, and I was really sick, but I couldn't get in to see primary care, so it was the next best.
That's the best thing. It's unbelievable, and that doesn't have to be. It's not the proper way to use it.
No, it's not. It's the worst. It's actually the worst way to receive care is in an ER
They don't
from
know
a
you.
doctor who doesn't know you.
He doesn't know you. He doesn't know what your chronic conditions are.
No.
You know what medication will work best for you. I mean, that's our job to do. So we always leave room for our patients in our schedule for same day. And not only that, we have on-call services. We push, call us first.
So all right, so that's another one. It's after hours, and you've got 24-hour care, 24/7 phone access. Talk about that.
Yeah, so if we can get sick from 9 to 5 in a perfect world, that would be great. I think that would save everybody lots of heartache and pain, right? I mean, things happen at 3 o'clock in the morning. It's life. And so we want to make sure that you have access to somebody who's a medical professional who can help you with, is this an ER? Can I wait till the morning? Can I try something that I have in my house? You don't know what's happening. And so we want to make sure that you call us first to know exactly the proper way to treat this emergency or urgent condition that you may have, to make sure that we treat that as best possible instead of having to go to the ER for everything because of time constrictions.
So if there is something that can wait, then there's a bridge there that gets you to that, so you can get in that day and see your care team
and give you that reassurance, like, look, okay, it
you're
sounds like you're going to be okay. This is what you need to do, and then I can contact your provider. Let's say I'm at State Avenue, but your doctor's at Truman. I can contact your provider. It's like, look, Carrie's not feeling well. I think he may have an upper respiratory infection. He needs to be seen today. Perfect. Front desk calls you, Carrie, let's get you in. We have a same day. We need to make sure the doctor checks you out and see what we need to do.
That's pretty remarkable. So talk a little bit about the online and live video. So you got live video televisit. Now I've used this, and my wife's used it extensively.
Yep.
It's really kind of a cool thing because you can do the visit right there without ever leaving your home.
Right.
Talk about that.
So our MAs will call you first. They're like, okay, Carrie, you have a video visit at this time. Is there anything you want to talk about? They prep me, making sure that I know. You check your blood pressure. If you have blood pressure cuff, let's check that. If your temperature, let's check that. And we can make sure that we're addressing everything that we need at the video visit. You get to see my face. I get to see your face. Sometimes when you guys come into the office, just seeing you tells us a lot. It's good to see how the patients are looking. It's a picture. It's 1,000 words.
You know the line most seniors use. They say, "Hey, it's great to see you," and the senior comes back and says, "It's good to be seen."
Yeah.
as you age,
right, right.
Yeah. So that's interesting. It is important, I think, for that face-to-face contact, whether it's in the video,
right,
and you can see how the person's reacting, behaving, what they look like, or whether it's an in-person visit.
And the benefit is, I know you. I know you well. Okay.
That's very, very different.
Right, because you're my patient. I don't have, 1,500 panel. I have my small panel who I know my patients really, really, really well. So I know when something's going on, if something's not being told, or I'm like, well, let me dig into this a little bit more. Something's not right. And so this is why we have to provide all these different types of access to our providers so that we don't miss anything with you guys. And there's no excuse to not have a communication with your provider.
I really appreciate you doing this today, Doctor, because I think this is going to surprise a lot of people. I don't think I've ever heard anything as in-depth in terms of dealing with medical issues and care for seniors as I've had today. This is a remarkable program. Yeah. And I hope we get you back here to do more of this, because it is very, very different, the way that you're delivering health care and the model and how it differs from the fee-for-service model is night and day.
Oh, yeah, for sure.
Thank you again very much for doing this. Again, if you're looking for a better way to receive primary care and you'd like to have the convenience of one place to go to with care coordinators and all these other things provided for you right there in the facility, you probably ought to take a look at CenterWell Senior Primary Care at CenterWellSeniorPrimaryCare.com. That is the website. And you can go up there. They've got 7 clinics all over town, in and around the Kansas City metro. Or you want to call them, 913-914-8202, 913-914-8202. Once again, thank you very much, Doctor.
Thanks for having me.
And now, ladies and gentlemen, I'll leave you with this thought from Dr. Martin Luther King. Americans must learn to live together as brothers and sisters, or we will surely perish together as fools. truer words were never spoken. Thank you for listening to America's Healthcare Advocate today, broadcasting here on the HI Radio Network, coast to coast across the USA. Goodbye, America.